colleagues in chiropractic. Dr. Vic Rizzo here with an encouraging word for my fellow chiropractors. This message is brought to you by the Pennsylvania Chiropractic Association. I recently had a 50-year-old male patient walk into my chiropractic office with mid-back pain of a few weeks duration. His pain was of insidious onset. It was a 9 out of 10 on the pain scale, and he was having some difficulty taking a deep breath. Now, this patient had been seen years prior with similar pain, which resolved quickly after chiropractic treatment. He's had a Sherman's kyphosis since adolescence. Due to his past history with similar pain, I had no alarm. However, after only minimal improvement within 3 days, and since the patient was a smoker, I decided to assist my chiropractic diagnosis with a thoracic spine X-ray, like many of you do. Please see my AP thoracic spine film. If we look at this film, we can see that this patient does have some degenerative changes, which I expected to find. However, we also see this patient has some a mass effect in the left lower lung region. Now, looking at this patient caused me to notice that the left hemidiaphragm was elevated. There was a hilar haze and airspace consolidation adjacent to the left pulmonary artery, and a shift in the mediastinum to the right was also observed. The patient was told that he has a mass in the left lower lung area, and he was told to go to his PCP as soon as possible with my X-ray report for a stat chest CT scan. Now, the patient initially resisted this because he had just lost his job that day. However, he developed some shortness of breath, and in a few days, his sister offered to pay for Cobra health insurance on him. So he went to the emergency room within a few days, and lung cancer was confirmed. Now, when I see this, when we look at this film, we see the mass effect in the left lung area. I did a P to A chest, which now is a P to A, and you'll see it on the right side of your vision now, a mass effect in the left lung, which is on your right viewing this P to A chest film. So it was consistent with the repeat film that day. So I had the PCP get involved or the emergency room, and here's what we got. A chest X-ray was first done, and a large left pleural effusion was found, and a mediastinal shift to the right was found, which confirmed my initial X-ray report. Then a CT scan was done. And if we look at number 2 on the CT scan report, a large mass-like consolidation is seen in the left upper lobe, extending to the left perihilar region, causing luminal narrowing in cutoff of the left main bronchus and also encasing the left pulmonary artery. Findings are likely represent a large neoplastic lung mass. And if we look down at the bottom, multiple hypodense liver lesions are also found, possibly representing hepatic metastasis. So we have an issue here with this patient, of course. Now, when we look at this, we see that chiropractic was very helpful for this patient. And one of the reasons I wanted to have this today is I wanted to share this story with you for a couple of reasons. First of all, I want to encourage all DCs in Pennsylvania to not let all the negative things you deal with each and every day take away from your importance in the community. Number one, you're all very important to your local communities for providing quality patient care. Number two, remember to do your best job each and every day. Number three, hold your head high because you're a very important physician in the healthcare delivery system inside your community. Number four, work in the best interest of all your patients every day. Number five, work with the medical community in a professional way, letting them know that chiropractors are real doctors and can make real diagnoses. Number six, and lastly, I'd like to give honor to all those chiropractors that have paved the way for us today in Pennsylvania to be able to practice freely chiropractic care to the best of our ability. Many years ago, my friends, I decided that chiropractic care was going to be one of the most important services offered in my community, and I was going to have to live up to that challenge. Colleagues in chiropractic, don't sell yourself short on your ability to diagnose and offer quality care to all the people of your community.